And my last reason or challenge that women face with thyroid problems is that they don't realize what the triggers are. Food can play a big part in this. And I talk a little bit more about this in my free thyroid webinar. Again, if you want to get on it, join the link right above the video. You'll see a link there. Feel free to share this with your friends, family members, whatnot as well. But foods can play a big part. And you just get on the internet, you can read about paleo diet, you can read about Atkins diet. I mean, there's a diet for everything, right? Unfortunately, there is no one size fits all. You know, what I recommend to one person, I may not recommend to another. And this is one of the biggest reasons why we get such good results. We do not offer a cookie cutter approach. You know, what we do here at our office is a very customized approach for each individual. I mean, doesn't that make sense? We're all different. Just as different as we look on the outside, we're different as far as on the inside, you know, how our body works, the food that we eat, the stresses in our life, the job that we have, you know, maybe environmental, you know, stressors or things where we live. All these play an effect on our body. And again, no two people are alike. So realize that. And food can play a big part. So 4 major food groups are the big 4, let's put them that way, that a lot of people react to. And these are just broad categories. Realize that we can get into much more details. Gluten, dairy, yeast, and soy. Those are the top 4. Now, that doesn't mean that you should just automatically get off of those. In fact, I don't recommend that if you don't have to, right? I mean, it takes a lot to change the way you've been eating. If you've been eating that way for 20 years, 30 years, it takes some time. And if you don't have to do that, I wouldn't recommend it. So what we do is we look at food intolerances. What foods may you be eating that causes an inflammatory response within your body? This could cause joint aches and muscle aches. This could cause fluid retention in the body. One of the biggest causes that I see for women gaining weight, despite working out, being active, and wondering, why aren't I losing weight, right? Maybe even work out with a friend or family member, they're losing weight and you're not. This is a big cause for it, our food sensitivities, not allergies. This is really key because a lot of you have had food allergy testing via pinprick testing or blood work. What I'm more concerned about is how does your food affect you internally? And oftentimes it's a delayed reaction that causes bloating, makes you feel fat, makes you feel, people say that makes them feel pregnant. I wouldn't know, but you know, it just makes you feel kind of blah. So you can understand how this can play a factor in your health. And very few people are looking at this and looking at the body as a whole. You can't keep guessing or looking at symptoms or finding a needle in a haystack and expecting to get some, you know, fabulous results. So I understand that, you know, a lot of you are frustrated, a lot of you are confused as far as what needs to be done or kind of where's a roadmap. And, you know, that's what we help people provide all across the country. It doesn't matter where you live. We can, you know, if you're looking for some help, I would be glad to at least talk to you first and see if we could possibly help you. I don't accept everybody for care. I only accept the people that are really committed and, you know, have been through everything and we're that, you know, next logical step. But really the purpose of me talking here isn't to plug my office, isn't to get more new patients. We're plenty busy, but it's to help you. And again, if you're looking for help, we are here to help you. So that wraps up my three challenges for, you know, that women have with thyroid symptoms.